This is a 15-year-old boy who has a congenital deformity. If you look over here, what has happened is, if you look at the spine, uh, normally your spine is supposed to be gently curved in the dorsal spine, but here, because of some congenital anomaly, the patient has this beak type bone which is going into the cord. You see this? So basically the surgery that we had to do, and as the child is growing, the spine is falling off like this, because of which the nerve supply over here from the brain to the legs are getting cut off, and this boy is practically paralyzed. So the surgery that we have done is we have put screws here to hold the spine in this place, and then we've cut off this extra bone from here. The By cutting off this extra bone, the cord comes back in its place, and the circulation from the brain is restored to the legs, and hopefully the child gets the power back in his legs. So that's the surgery. It's called as a kyphosis correction and internal lumpectomy surgery.